Here we are. This is what the big story is all about: vaccination. So they come in vials like this, and then they are taken out by the syringe and then injected to you. Okay. So what are vaccines? Okay. Again, some of you might already know, but vaccines don't actually do anything to the virus. Okay, let's get that straight. So the vaccine actually stimulates your immune system so that it can fight the virus faster and in a more efficient manner. Okay, so without the vaccine, your immune system might not be able to recognize this virus, and because of that, you get infected faster and at a more severe state. Okay, so the vaccine actually does not kill the virus; it just stimulates your immune system to fight the virus. Okay, so there are various platforms of making this vaccine. Okay, we can use RNA genetic sequencing, we can use vectors, we can use deactivated viruses and protein subunits as vaccines. Okay, so this is what the different vaccines are all about. It's just the way they are made and the way they stimulate your immune system, which is a bit different from one and another. That's why you have these different brands or different makes of vaccine. Okay, so vaccine is not new. Vaccine dah lama dah actually vaccines. Okay, so we have a national immunization program to protect Malaysian citizens from vaccine preventable disease. If we look at your arm on your left or on your right, you are bound to see your BCG vaccine, okay, and probably other scars from other vaccines that you have taken. Okay, measles, mumps, rubella. Some of you might have chickenpox. Some of you might have hepatitis B vaccine. So you yourself have a lot of vaccine inside you already. Okay, so there are about 20 over vaccines in the world that is given quite periodically, and so far none of them have caused long-term side effects. Okay, so they are quite safe. So to give you an example, smallpox, okay, cha-cha, now there's no more in the world because of vaccination. Yeah, because of vaccination, there's no more smallpox. Okay, but when firstly this smallpox vaccine came out, the mothers would bring their children in the West, in Europe. They will take their children and run up the chimney. Okay, because they want to hide from the people coming to vaccine their children. Okay, so with regards of anxiousness with vaccine, also dah lama. Okay, a long time ago, even before people are scared of vaccines. Okay, if you are Muslim, you are required to have a meningococcal vaccine if you want to go to Hajj. Okay, so this is compulsory to all Muslims going to Hajj, no matter from wherever you are. So this is a Singapore COVID-19 vaccination program infograph. People usually ask me, doctor, can I have the vaccine because I have so and so, because I have so and so. Okay, so there's not many things that does not allow you to have the vaccine. Okay, if you have a very serious form of allergic reaction, one which is life-threatening, usually involve breathing, yeah, and it happens quite quickly after the injection. You have difficulty breathing, your throat swells up and you can't breathe, and you've had this before, then you can't take the vaccine. Okay, if you have a severely weakened immune system, then you can't take the vaccine. So if you have HIV, if you have cancer of your bone marrow, if you are on treatments to lower your immune system, okay, for certain diseases, autoimmune diseases, SLE, so forth, then you might not be able to take the vaccine. Okay, if you have a low platelet count, then you might not be able to take the vaccine. But if you have any other condition, you should be able to take the vaccine. If you have high blood pressure, if you have cholesterol problem, you have diabetes, you have kidney problems, you had a heart attack before, if you are old, if you are frail, you can receive the vaccine. No problems. Okay. In fact, if you have any of these problems, if anybody has any of these problems, then you would be advised even more to take the vaccine, because if you don't, then you can have problems in the sense that you can, if you do get COVID-19, it will be worse on these people who already have these comorbidities. Okay. And if you look at those people who die from COVID-19, nearly all of them will have comorbidities. They will have some other health problems um, underlying, and that's what makes the COVID-19 even more severe and most of the time fatal. Okay. How does the vaccine work? To know how your vaccine works, you must know how your immune system works. Okay. We all have an immune system. Your immune system is like an army, soldiers protecting your body from viruses, from bacteria, from anything that can harm your body from the outside. Okay. So if you can imagine, these soldiers travel around your whole body through your bloodstream, and if they find somebody or if they meet a bacteria or a virus, and if they recognize that bacteria or virus as something which is bad, they can produce antibodies to destroy the virus. Okay, so that's how our vaccines work. Okay, now for that to happen, um, your soldier, your immune system must meet the virus first, and then have and be familiar with them and recognize the virus. Okay, for example, what happens before is that when you have a new pathogen is something that can cause you harm. Okay, so if you can imagine this virus, say this is the SARS-CoV-2 virus, COVID-19 virus, the first time it comes into somebody's body, infects a new patient, that person's immune system has not seen the virus before, so it cannot produce any antibody to destroy the virus because he's never seen it before. Okay, so he has to go back to base, make the antibody, and then come and destroy the coronavirus. Okay, but that takes time for it to go back, make your antibody, come back and attack it. It takes time. During that period of time, this new virus might multiply in the body. Okay, they multiply, and they can cause harm to the host before your immune system can produce antibody to kill it. Okay, so if it reproduces too much, then problem will arise. It will take you over, and then you get very severe COVID. Okay, but if you have a very good immune system and it produces the antibody quickly, it then can attack and destroy the virus before it causes any harm. So these are the patients who don't get so bad with the COVID-19. They have very mild symptoms or they are asymptomatic. Okay, so what happens after after your immune system produces antibody to attack the virus, it then develops a memory. Okay, so it develops a memory in the sense that it will remember the virus. So the next time it meets the virus again, the antibody is already there because he already remembered from before that this is something that they've met before, and they've already produced antibody for it. Okay, so for example, we all had, if you had measles before, right? So the first time you have measles, you make antibody, and then they recognize the measles virus. Okay, so next time they see the measles virus come into you again, then the antibody is already there. Okay, because it's already ready, because it's been exposed to it from before. The same with chickenpox, for example. If you already had chickenpox, or you've had vaccination for chickenpox, then your body already has the antibody to attack the chickenpox virus the next time you meet him. Okay, again with the flu virus is the same. Okay, so because the body has been exposed to this virus before, it has produced antibody. So the next time our body is exposed to this virus again, we already recognize it. Okay, so that's how basically a vaccine works. Okay, example, this is your coronavirus virus. Okay, the SARS-CoV-2 virus. It looks like this. So the Sinovac virus, the one from China, they inject the whole virus into your body. Okay, while I say whole virus, it's not a whole live virus. It is a dead virus. Okay, they grew it, they inactivate it in the lab, and then they inject it into you. So by injecting a dead virus, you cannot get COVID-19. So from the vaccination, you cannot get COVID-19 because the virus is already inactivated. Okay. But what it does is once it's injected inside, your immune system is exposed to that virus, and then it produces antibodies to that virus because it's already seen it. So these antibodies which are produced is now ready to be used if next time you are exposed to a real COVID-19 virus. You are exposed to it, the antibody straight away kills it without waiting it to be made, so there's no delay. So your immune system is already ready to fight the virus, the coronavirus. Okay, so that's what happens. So the Sinovac vaccine injects the whole virus. Okay. There are also some other vaccines who do not inject the whole virus. All they inject is the outer part of the virus, these spike proteins, okay? These thorns or these duri on top of the virus. They just inject this into your body. They don't inject the whole virus. But by injecting this, again, your body can recognize it, your immune system can recognize it, and it can make antibodies to these spike proteins. So the next time a virus comes in, that virus will have this spike protein on top of their on top of their surface. When your immune system sees this spike protein, although he hasn't seen the whole virus, it recognizes this spike protein. It can produce antibodies to it to prepare itself if they're exposed again to the next virus, okay, to the next COVID. Sometimes you can just inject the genetic material. For example, the Moderna vaccine, the Pfizer vaccine, they don't inject the virus. They don't even inject the duri. They don't even inject the spike protein. They inject the RNA of the virus, okay, but not the RNA of the whole virus. They just inject the RNA. RNA is instructions, okay? It is a gene that instructs your cell to do something. So this gene they inject is the RNA or the gene that instructs them to make this spike protein. So it goes into your body, it goes into your cell, and your cell reacts to this instruction and they make this spike protein. And when they make this spike protein, when it's exposed to your immune system, the whole cascade starts again. Your immune system will produce antibody so that the next time a real virus comes in with the spikes, they recognize it and kills it straight away. Okay, so that's basically how your vaccine works. Okay, so the RNA and DNA vaccine in Pfizer, BioNTech, the Moderna vaccine uses this. The AstraZeneca vaccine is a vector vaccine. So the Sinovac vaccine is a weakened virus vaccine. They just inject the whole virus. Okay, so this is the modern one. Okay, this is the first time RNA technology has been used to make vaccines. Okay, so people are scared because alamak, they letak DNA, RNA inside my body. So what of this RNA and DNA decide to make me into a Hulk or something like that? No, it doesn't happen. Okay, it doesn't go into your DNA. It just goes into your cell. Okay, so that's how basically vaccines trigger immune system and how they work. Okay, so this is roughly, so you can either inject the whole virus or part of the virus. Okay, but at the end, this is what your immune system recognizes, either on its own or part of a whole virus. So next we talk about the vaccine. What happens? The most important thing in when we start giving the vaccine is that you need to be the frontliners need to be protected. Obviously, okay. The first, the most main thing is to protect the frontliners. The second is to reduce the severity of the disease. So somebody who gets COVID-19, somebody who gets the vaccine can still get COVID-19. You're not 100% protected, but if you do get COVID-19 vaccine and you already if you do get COVID-19 but you are already vaccinated, then your disease is not so severe. Okay, so you don't die from it, Okay, if you do already have the vaccine, or if you require ICU, if you have the vaccine, maybe if you require ICU, you don't get the vaccine. If you get the vaccine, maybe it downgrades. You're in the normal ward. Okay, some people who might have a little bit of symptoms because they get the COVID-19 vaccine, maybe they become asymptomatic. So it reduces the severity of the disease if you get it. Okay. The third strategy is the one that is preventing the spread. Okay, so actually preventing the spread is not the main point of the vaccine. There are other main points of the vaccine. Okay, most of them mostly is to reduce the severity of the disease. Okay, so there are three phases to the current vaccine. As you can see up here, the first phase already finished. All our frontliners have already been vaccinated. Now is phase 2. Most of the senior citizens above 60 and those with comorbidity are currently taking the vaccine. And the third phase would probably be the rest of you who are well 18 years and above. Okay, siapa yang dapat AstraZeneca tu, good lah. Alhamdulillah, that's better. That's a lot better. Okay, so you might also heard about herd immunity. Partly, we want to achieve herd immunity. What is herd immunity? If you notice, okay, if you look at this population, yang orange ni, the person in orange has COVID-19. The one in blue are vaccinated, and the one in grey are not vaccinated. So this one guy, in a few days, can infect all these other people. Okay, bar these 5 people because they're vaccinated. There is no herd immunity here. But if you get a lot of people vaccinated in the same population, this guy can still spread it, but he can only spread it to the guy next to him. Okay, this guy here, although he's not vaccinated, he's protected from these two fellas because there are other people in between them who are vaccinated. So this is herd immunity. Okay, it's like you're trapped in rain. You're trapped in the building. Outside is raining, but you need to go out to get to your transport, to the bus. Okay, there are 10 of you, and 8 of you got umbrella. So using the 8 umbrella, you can susun all the umbrella, and 10 people can go under the 8 umbrella, and hopefully nobody gets wet. Okay, so that 8 umbrella can cover 10 people. But if you only have 3 umbrella, then there's no herd immunity lah. However, you susun the umbrella also. If you go, all 10 of you go under the 3 umbrella, there's bound to be some people who get wet. So these are the different vaccines that Malaysia is taking. We are having more vaccines than there are population, which is good. The biggest one is your Pfizer vaccine. 50% of the doses of the vaccines are from Pfizer vaccine. Okay, the second one is AZ. But you can see the problem with Pfizer vaccine is the storage is extremely difficult. Yeah, suhu penyimpanan -75 degrees. So storage of this vaccine is extremely difficult. Okay, but they are all good in the sense that they reduce the severity of the disease. So what happens when you need to get your vaccines? Again, you register from MySejahtera. You receive an appointment date, and then you present yourself to the vaccine administration center. They check your temperature, and then you are seen by a doctor, and they consult you. And if you're okay, you're given an authorization form to sign, and then you're given your first dose. Yeah. After that, you're observed for 15 to 30 minutes to make sure there's no anaphylactic reaction, and then you receive your vaccination card. And then you will monitor for side effects in MySejahtera app. Okay, any side effects you report in MySejahtera app, and then you will receive the next appointment date about your second dose, and then it starts all over again until you finish your second dose, and then you get your digital cert for your vaccine. Okay, so simple, straightforward, and it's quite efficient. So side effect ada banyak. Most of us will get side effects, but they are not serious. Most of them are mild and temporary. The most common ones are listed here. Of course, pain and swelling at the site of your injection is very common. Fever, temperature, nausea, tiredness, headache, joint pains, feeling unwell. All these are quite common, yeah. Some can have diarrhea and vomiting. That's also another one which is not here. But the most dangerous one is anaphylactic shock, shortness of breath, which usually does not happen. That's why we ask you to wait for 30 minutes after your vaccination. Okay. Long term, we don't know, but from experience, all the other vaccines that you had from 50 over years ago, 70 over years ago, does not show any um, long-term side effects even now. Okay, so the benefit definitely outweigh the risk, especially for elderly and those with comorbidities. So when I had my first dose, I had a bit of pain and fever, but I still ran, I still did my exercise. There was no problem. So you shouldn't have any problem. Just see how you get on. If you get those if you get those short-term side effects, you can take Panadol, paracetamol, no problems. And sometimes the side effects can go up to 2 days. Okay. So again, fatwa for COVID-19 vaccination, it is actually harus, yeah. So our Muzakarah of National Council for Islamic Religious Affairs has made it harus for Muslims to have the vaccine. So even worldwide, other Islamic authorities have also said the same with regards to the vaccine to be used in other Muslim populated areas in the world. Okay, so it is actually positive. Deaths have plunged in this town in Brazil. Okay, they have made a study in this town. About 40 over 1,000 people. Every adult in that town was given a vaccine, and everybody responded to it quite well. Death in that town, 95% dropped in COVID-19 death after the vaccination, 80 over percent reduction in hospitalization. So there is a lot of studies slowly coming up that vaccination actually helps in the bigger picture. Okay, this was so successful until a lot of the Brazilian people in big cities wanted to buy a house in this small kampong. Okay, because they wanted to get the vaccine. Okay? It's not the same in other cities in Brazil because vaccination is not evenly spread out in the country. Okay, this is another thing that I want to put forth. Yeah, probably the last thing here: how to spot and stop fake news. As a doctor, since this pandemic, more and more time I have is being used to try to debunk myths, okay, and fake news. It takes a lot of our time. Yeah, I can say every day I would spend at least 1 hour replying to messages, replying to queries about all kinds of things. Okay, so if you do get some news in social media, please consider the source. Okay, look at it properly. Where did this come from? Read between the lines. Okay, what's the whole story? Don't just read the title. You must read the whole story. Any supporting sources. Okay, any links given below for further reading for you to read to support what the article says. Okay. Do other people agree? Some people, is it a lone or one person's opinion, or is it a multiple person's opinion? Okay, is it a joke? Most of it is a joke. Some people really can't take a joke and even worse, some people can't even differentiate a joke and between a joke and something that's not a joke. Okay, check your bias. Right? If you believe in something, then you will only Google for that thing. Okay, for example, if you believe that the world is flat, you will only Google to prove to yourself that the world is flat. You will find articles in the internet to prove that the world is flat. Okay, so check your biases. Ask the experts and look before you share. Yeah, so you have a lot of WhatsApp messages that is forwarded to you, and most of the time, some of them have on top of the message, so they're forwarded many times. Okay, if they're forwarded many times, they are probably fake lah. Okay, and again, don't forward things that have not been verified. Okay, the other thing I don't quite like is people who forward and then at the bottom they have the caveat, they said, oh, above not verified. Okay, so if you don't verify, please don't share it lah. So in summary, COVID-19 spreads very quickly if not controlled. Transmission is only via droplets, yeah. So you cannot transmit from anything else but droplets. So important for you to wear your mask and sanitize, and also social distancing, yeah, physical distancing. We need to protect the elderly and vulnerable. So remember, uh, if you kena COVID, you might have no symptoms, you have very mild symptoms. Okay. So then you will say, what's the big deal? Tapi you can bring it back and give it to your grandparents, to your parents, to those elderly people who might not have the same outcome as you. Okay. We are responsible to flatten the curve to reduce the number of COVID-19 in the public, and everybody needs to play a part to prevent the outbreak. Yeah. So vaccine plays an important role in controlling COVID-19. And last but not least, don't believe everything that you read, and don't read only the things that you want to believe.